Prynawn da, o croeso I chi gyd. Vivian Harpwood ydw I, Cadeirydd Bwrdd Iechyd Addysgu Powys. Rwy'n falch iawn o allu croesawu chi heddiw, y gyfarfod cyffredinol Blynyddol ein Bwrdd Iechyd. Good afternoon to you all. I'm Vivian Harpwood, Chair of Powys Teaching Health Board, and I'm delighted to be able to share with you Powys Teaching Health Board's annual general meeting via live stream. It is unfortunate that for the third year running, we're unable to hold our AGM in person. But given the prevalence of COVID at the present time during the preparation for the AGM, it was felt it would be inappropriate to hold an in-person event, particularly indoors. I do, however, hope that our staff and the people of Powys are able to benefit from this accessible but rather different way of working, although it isn't so different to many of us now. 2021 to 22 has again proved to be an extraordinary year in the global pandemic. It's continued to impact on our daily lives. And this is certainly true of the way in which the development and delivery of healthcare has taken place for our Powys population. And our 2021-22 annual report is framed in that context. However, I would like to say here that what has sustained us all, staff and anybody, in fact, connected with the health board, including our patients, is our set of values that we have in Powys Teaching Health Board, which were developed and agreed by our staff. They're invisible, but they do inform everything that we do, and they ensure that we show trust and respect and integrity as far as we possibly can at all times, and that we work together with kindness and caring behaviour, taking account of equality and fairness. And all those values have, I hope, been reflected in the behaviours of staff to one another and to our patients over the past year, as indeed they should be at all times, of course. And the majority of our services have continued to operate with appropriate changes, of course, to ensure a COVID-safe environment for our staff and patients. Recovering from any challenging incidents, such as a pandemic, calls for diversity of thinking and approach. And this has resulted in an incredible amount of innovation. And this is providing the foundation for our recovery, the renewal of our services and transformation programmes. The health service, along with partners and specifically with patients, service users, carers, our wonderful communities, has developed better ways of providing access to high quality healthcare in many cases, providing more rapid support with a focus on people's own homes and lives, rather than being limited by the constraints of services and buildings. Examples of these are highlighted throughout our annual report and will be presented during this annual general meeting. I extend my sincere thanks to our staff, stakeholders and partners for the extraordinary contributions they've made during 2021 to 22. The proceedings this afternoon will be led by Carol Shillabeer, our Chief Executive Officer, who will present our annual report for 2021-22 and introduce colleagues who will showcase highlights from the year, as well as some of the challenges that we face. Pete Hopgood, our Director of Finance and IT, will then present the Health Board's financial position for 2021-22. And finally, there'll be an opportunity for a question and answer session with the board, which will start shortly after 3 p.m. and we hope to close the meeting at 3:30. I'll now hand over to Carol Shillabeer, our Chief Executive, who will proudly present the highlights of our annual report for 2021-22.
Diolch yn fawr, Viv. Thank you very much indeed. Carol Shillabeer ydw I. I'm Carol Shillabeer, and I'm delighted to be here presenting the key aspects of the annual reports for the Health Board for the year 2021-22. Yes, I hope to be able to present a flavour of the achievements of colleagues, teams, partners across the organisation and across the wider health and care system. And I start with an apology that with just under an hour to get all of this in, I can't pretend that I'm going to get across the wealth of that innovation and development that colleagues have been leading on, but I would commend people to take a look at some of our material on our website, including our annual report. So we started the year with a set of strategic priorities, and as the chair has said, very much based on our values and our principles of working, and many of our stakeholders and our staff will know only too well how strongly we feel about the health and care strategy called A Healthy Caring Powys. This was a strategy developed with the people of Powys, over 10,000 pieces of commentary to help form that strategy back in 2017. And whilst over the last couple of years, we've had to adapt to develop annual plans, the strategy continues to be at the heart of that approach. So just on the screen now is the really plan on a page strategic framework that we were operating in during 2021-22. But as we go through, I'll give you a flavour of the key areas of our work across all of our well-being goals that we have very much taken to heart here in Powys. So the next slide gives a starting point for us in terms of focusing on well-being. This area of our work is really important, and has perhaps had a greater highlight than ever before during the pandemic. As a health board, our purpose is to help improve the health and well-being of the population, as well as to provide or secure healthcare services. So in our focus on well-being section, we've just pulled through a couple of key things. Through the pandemic, we have developed new services that help people to recover from COVID and to rehabilitate. Now, many people might recognise this as long COVID, and those services have been built upon by a multidisciplinary team, doctors, psychologists, occupational therapists, nurses, and others, to really support people on their recovery journey from COVID. That is a new service that we've put in place at the heart of our focus on well-being. It's been really well evaluated, and importantly is one that is available within Powys rather than people having to travel outside of the county. We've taken a fresh approach to adult weight management. We know that weight management is such a critical part of preventing ill health, but also promoting well-being. And just this morning, if anyone tuned in to our board meeting, we had the discussion on weight management during that session. We've got high ambition around really helping people to help themselves support their own well-being, but with that expert guidance provided by our clinical health professionals. We've moved to lots of video consultations, group video workshops, and online videos, and many of us have got used to that now over the last couple of years, but just to recognise that that may not suit everyone, so our services aim to be flexible around the needs of an individual. What's been really important in this area, particularly during the pandemic, is some of those really key interventions that we know promote well-being are are critical and have been highlighted. So childhood vaccination is such a straightforward intervention. It is reasonably low cost, and the evidence is very strong for vaccination. And I'm delighted that as a county, Powys really takes vaccination immunisation to heart. But we're on catch up. Our uptake is certainly improving, but there's still a bit of room for improvement for measles, mumps and rubella uptake in children aged 5. So if you're watching and you've got children in that age group, please do come forward if you've yet to do so for the MMR vaccination. We continue to have high breastfeeding rates, and our expert advisors support mums across the county, and that shows in the highest rates of breastfeeding in all of Wales is in Powys. And then finally, just on this slide, I wanted to draw particular attention to influenza. Brilliant improvements in the uptake of the influenza vaccine in the last season, particularly amongst those who are 65 years and over. But we've got a lot more to do for those who are under 65. And I would really stress how important it is coming into now this autumn and winter for those people who are eligible to have their COVID vaccination and their flu vaccination. And I think that will be something that we could all engage in trying to protect ourselves and our families going forward. The next slide continues on the vaccination theme, and I have been absolutely thrilled to see the uptake in the COVID vaccination here in the county, and I'm extremely proud as the Chief Executive of the Health Board that we have the highest vaccination rates in all of Wales here in this county. Now, we have many things that could conspire against us there in terms of geography and accessibility, but working together with partners, we've overcome that, and hence 89% and probably more even since we've written these slides of people have been very actively engaging in vaccination, whether that's the primary course, whether that's a booster. Children and young people aged 5 to 11 are being offered the vaccine as well. And as I said, we're preparing now for the season ahead. And that's going to be a very important season, because I know we were all rushing to get vaccine when COVID rates were so high, but this is something that will become part of the norm now as we move hopefully out and through the pandemic. I do want to just give a note of thanks to many different colleagues who worked with us. You can see on the slide picture of the RAF colleagues who came and helped work with us in Powys. Delighted last week at the Royal Welsh Agricultural Show to see them again, and a parade of health and care colleagues with the tremendous volunteer effort. And I was absolutely astounded by some of the statistics, and the volunteers giving over 1,000 of their own personal hours to the vaccination campaign and work. So that's been absolutely phenomenal, as has the Test, Trace, Protect service. So whilst there have been changes now, of course, with COVID stable, that was a service that had to be established completely from scratch, be quite flexible to the needs of the population, and deliver that all-important telephone contact and advice service. I'm moving next to, I'm sorry I'm going through quite quickly, there's so much to cover. I'm very keen to make sure that I do indeed cover as much of the organisation's business as possible. So I'm moving next to primary care. This is part of our early help and support, and we have improved access to general medical services. Now, I know that the headlines may say something different, and very happy to be challenged on this, because the pattern of accessing general medical services, or many people call it general practice, GPs, has been different. So many more telephone appointments, what we call sort of office medicine, so email advice, etc. And that mix and blend of appointments continues as we go through. What is really clear is the number of appointments, the number of contacts in general medical services has significantly increased through the pandemic. And I've just put a few numbers in to try to help demonstrate that. So 14,500 extra appointments provided, and that's about 9,000 additional hours of service. The Health Board, together with the primary care colleagues, have introduced a pilot of urgent primary care, and that's to try and support people to access that care on an urgent basis in county rather than having to travel to district general hospitals. Now, we all know that dentistry is a key issue, and if you were watching the Wales News last night, you will have picked up some of the changes that government are making around dentistry, and we have a real challenge in our own county, which is why it's a significant priority for us. The pandemic adversely and significantly adversely affected the numbers of people that could access a dentist, and that's because dentistry is often an aerosol generated practice and procedure, and the therefore risk of COVID infection being passed on was high. So a real challenge for this part of the healthcare system. So what have we done as a health board? Well, we've put in an access support line for people, and that's helped over 5,000 people to secure a dental appointment and some support. We've put 55 additional urgent dental appointments in per week, and with the new contract, 7,000 new patients will be able to be treated. So we're really working hard on dentistry. And if I can just say as well that our own community dental service that we provide as a health board has been expanding to support those areas wherever possible where general dental services, so with the high street dentists, have been unable to meet the need. And then just finally on primary care, the role of pharmacy and optometry is really important. And I wanted to just mention that following a pharmaceutical needs assessment, we identified there was a gap in Llanwrtyd Wells, and I'm really pleased that we were able to work to ensure that a longer term pharmacy provision is available there in the town, and really pleased we were able to do that. I'm going to pass next to a colleague who will take us through some of the aspects of diagnostic, ambulatory and planned care. So welcome to Steve Powell, and thank you very much, Steve. I shall hand over to you.
Thank you, Carol, and good afternoon, everyone. My name is Stephen Powell, as Carol has said, and I'm the Interim Director of Planning and Performance at Parish Teaching Health Board. So I'd just like to update everyone on this area of diagnostic, ambulatory and planned care, and by and large that's the generic term given to patients waiting on a waiting list for the aspects of care described. And Parish as a provider arm throughout the 21-22 financial year has made good progress on the recovery of services and waiting lists and the reduction, because obviously in the first wave of the pandemic a lot of services were stood down and waiting lists increased in size and the duration of time elongated for a very large number of patients. So the Parish provider arm has made a significant recovery during this year, and for diagnostics access times in particular, we now only have a small number of patients waiting over the 8-week standard. Similarly with therapy services, whilst there are some patients waiting more than the 14-week standard for care, we're on an improvement trajectory to reduce that. And for both diagnostics and therapies, we aim to be back compliant with those standards now during the current financial year. And finally, the wider referral to treatment standard, and that's typically where a patient accesses consultant level care delivered in Powys. The backlog that did arise during the earlier phases of the pandemic has largely been eradicated, and whilst there are now a few patients waiting over 36 weeks, we've got plans to ensure that no one waits over that duration, because no one should wait that period of time. The performance that I'm referring to is just in relation to our own provided services within Paris, and the next slide that I'll refer to is the performance then of our commission services, where we purchase services outside of Paris from across England and Wales for services that we don't provide ourselves. And so this particular slide therefore focuses on those services for planned care. And so the position of our English providers, that's Paris patients waiting in hospitals, typically in either Shrewsbury, in Telford area, Wye Valley, Worcestershire, and Robert Jones. There are 46 patients waiting over 2 years for treatment, which is a very long time versus the 26-week expected standard. But the English providers are on track to eradicate those long waits now by the end of July, and are making good progress to do that. The position with Wales, across Welsh providers for Paris patients waiting, is not so good in terms of recovery of long waiting patients. And at the time of preparing this slide, there's 718 patients waiting over 2 years. So we're working with health boards with their recovery plans to see at what stage those patients will be seen, and are there any opportunities for patients that are waiting longer elsewhere, if they could come back to Paris to be treated where clinically appropriate and safe to do so. Now, that won't always be the case, because the very nature of their condition or procedure required, but it's something that we're actively working on. There have been difficulties also with timely follow-up outpatient appointments following a procedure, and part of the NHS's approach to reducing those backlog is to seeing the implementation of 2 new services, one called See on Symptoms and the other called patient-initiated follow-ups. So you may well experience an offer, if your condition merits it, that you may well be offered that as an appointment, as a way forward for managing one of your follow-up appointments. The next few bullet points just then describe some of the developments that have occurred in our Paris provider arm. And the first one is a new wet age-related macular degeneration service in London and Wales. That's what AMD stands for. That's and also a nurse injector service with excellent outcomes, and that team have actually presented at international conference in terms of the way the service has been mobilised in a community setting. There's been a new multidisciplinary ophthalmology service in North Paris, and not only does that bring the service closer to home, it also reduces travel times, and we've saved around 42,000 miles through more care delivered in county, with the obvious benefit to the environment. We've got a new screening services for eye care and rheumatology patients. We've got nurse-led glaucoma clinics, digital eye care pilots, services being trialled in astragalus mice. And finally, we're running what's known as vascular mega clinics, which is a one-stop shop for patients, and we're seeking to run one of those per month to reduce the backlogs. So there's a lot of work being undertaken to address the issue of long waiting patients. There's still a fair bit of work to do, but we're on the right direction of travel. So thank you.
Thank you very much, Steve. It is great to see some of the new services coming through. That whole ethos of care close to home was a big theme that came through from people when we were developing the health and care strategy. And adding that miles saved is always really helpful, not least because of cost and financial cost of fuel, but also the cost of the environment. So thanks very much, Steve, for flagging those elements. I'm going to touch now on some of the services that support children, young people and families. And this is an area where we really do work closely with other partners. So our colleagues in Powys County Council, in the voluntary sector, and across communities, really, not just in relation to health and care. And of course, children spend very much of their time in schools. So really important that our emotional health and well-being services are wrapped around where children are. And one of the visual areas in the slide shows what something is called the NEST framework. And we've been working together to see how we can improve the support for children in schools, so something called a schools in reach, whole school approach, but also right the way across the system. On the more specialist CAMS end of things, though, I'm really pleased that we are consistently meeting the 4-week standard for young people to have their first appointment. We've got something in place called the single point of access, so no wrong door. So you know people can't go to the wrong place. They get moved into this single point, and where a single assessment takes place, and that seems to be working well and is helping to shorten the time of waiting for that help and support. So really pleased with that. The other area that we're pleased with, but there's a lot more to do, and that's around neurodevelopmental services. So for children, young people and their families who have a concern about a development issue, a neurodevelopment issue, and I'm not necessarily using diagnostic terms such as ADHD or autism. It could be a very broad range of presentations. Then the standard at the moment is to undertake that assessment within 6 months. And we have had much higher levels of referral into this service over the last year or so. Plus, we have had quite a significant number of people who were already starting to get into that referral and assessment system, but for whom, when the pandemic struck, you know, schools closed and that sort of thing. So very challenging to undertake those assessments. But I'm really pleased to say that we are now meeting that standard as a health board. We stand out in that regard amongst areas in Wales, and that's because we put some additional investment into that service, and our practitioners there have found new ways of working to try to support people. The other couple of things I want to just pull out relate to maternity services in particular. And for anyone who follows the work of the board, you will have already realised through this year that maternity services have been a key priority for us. The Ockenden review, Donna Ockenden's work in Shrewsbury and Telford Hospital Trust started many years ago, and we've been working closely with that system around the issues of concern and supporting families who are interacting in that review. Now that has now reported, and it's very clear that there are actions in that review for all maternity services to consider. And similarly, the picture in relation to the Cwmtach Morgannwg maternity services, and we've been very much involved with what's called the IMSOP panel. That has overseen on behalf of the Minister some of those developments, and grateful to that panel who have interacted with us because, you know, Cwmtach Morgannwg is a neighbour of ours, and some of our residents will access services there, maternity and neonates, and more so in the future. And then as an organisation with experience in these escalated issues, we are contributing to Wales-wide improvement work on maternity and neonates. So quite a lot going on in that area, and it is, you know, quite rightly an area of focus. I just want to move to the next slide now, which looks at tackling the big four. And for those less familiar with our strategy, the big four are those big four diseases that actually limit life and quality of life for people in Powys. So I'm going to just spend a moment talking about mental health, dementia and substance use, if that's okay. What we have seen particularly I think coming as a result of the pandemic, is an increase in referrals for people needing some mental health support. In some of our adult service, that's gone up by about 25%, and that's been a real challenge for us to be able to see that many more people in a really timely way. And whilst most people receive timely assessment and intervention, some people are waiting longer than the 28 days that is the standard, and we're working really hard to remedy that. We have had some staffing challenges. It is an issue in mental health services around sustainability of workforce. And that's an important thing for us to really focus on, the longer term approach to supporting people with emotional and mental health issues. But more people are accessing inpatient care in county than previously. Certainly a few years ago, we were using other providers, but the majority of that now happens in Powys, which is fantastic. The other development is that people are accessing psychological therapies within the 26-week standard, and again, a single point of access in place, and that is critically important. Several years ago now, we had waiting time of over a year and more for people to access psychological therapy, and now the 26-week standard. But I'll just pull out the silver cloud. You can see the image at the bottom of the screen. That silver cloud is talking therapy, a psychological therapy for a range of presentations and issues, and that is available, easily accessible through the internet, through an app. And the uptake of that has been absolutely brilliant. And we were the first health board to have that. That was part of an EU project many years ago now, back to 2016. And we now lead the implementation of that throughout Wales. So I'm very grateful to the mental health team for all their work on that, making mental health support much more accessible. We do know, though, that we need to do more on helping to diagnose dementia earlier, and that is a major priority for us. So diagnostic CT scans are key in that diagnosis, and we're working hard to improve the access to that, as well as recruiting memory assessment nurses and people who can prescribe who aren't necessarily doctors, so they're designated healthcare professionals with that permission. And then finally, I just want to touch on alcohol. We know there was a media coverage of this yesterday, that alcohol use during the pandemic has gone up, and that if we can't support people to make some changes, that may well impact into the longer term. So that's very much part of our work, as well as suicide and self-harm prevention. And people came together recently to launch a forum, and some really key developments implemented already, particularly in the support of people that are affected by these tragedies. I just move on then to another part of tackling the big four, which is breathe well. And I'm going to go through the detailed slide, because for people who tune in to the regular Chief Exec briefings, the public briefings, you may well recall that Claire Madsen, who's our Director of Therapies and Health Sciences, did a whole session on breathe well. But I'm pulling this out because this is a sign of innovation that has happened here within Powys. So and in particular, it's been sort of expedited by the pandemic. Now, of course, the pandemic, the COVID-19, a respiratory issue, and so really quite challenging. You know, the whole Breathe Well programme looked to engage with the issues and the opportunities that the pandemic brought. We've been taking a value-based healthcare approach. What that means is focusing on the outcomes, so things that work, things that matter for people at the best cost, because we know that the pressure on the public purse is such that we need to spend every penny and every pound of taxpayers' money really well. And we've been able to really push forward some of these key developments. So if I talk up for a moment about pulmonary rehabilitation, it's a specialised programme of education and activity there to support people with lung problems. And we tested out back in autumn of 2020, so we're right in the midst of the pandemic. Could we do that virtually so people from their own homes can get involved in that programme? And you know, it was fantastic that so many people have engaged with that, and actually the completion rate was very successful for a programme of that nature as well. We've brought back sleep apnea diagnostic clinics back in November of last year, and the oximeters, the little devices that measure breathing through sleep, get posted to a local hospital site. Patients pick them up and use them, and then with the clinical input over virtual appointments, and we've had great patient feedback. So if you're one of those patients who've experienced that new service, thank you very much for sharing your experiences with us, and we hope to keep working on this and developing it. We've been providing additional advice and support for people with breathing difficulties, particularly those with asthma and COPD. So that is a really important thing, particularly over winter, as the respiratory issues sort of do exacerbate during that season. And we've got apps and those sorts of things that are there to help people to manage their conditions. The final part of the Breathe Well, the tackling the big four, area that I wanted to touch on was cancer care today. So the pandemic has significantly impacted issues relating to cancer, and we know that outcomes for people who have cancer are much better if we can pick it up early, if we can identify it at the very earliest stages and get treatment underway. And one of those picking it up early, one of those measures is around screening. So we know that screening was suspended for a time during the pandemic, and so we've been very, very keen to ensure that that is back up and running and the catch-up takes place. So what's really good is the bowel screening. All of that is now caught up, and the introduction of FIT testing, and that's a test that you can get through the post, is helping to identify people who may have the early stages of bowel cancer. And again, for those people who were watching this morning's board meeting, we had a specific presentation on cancer that gave a bit more detail on this. Breast screening has not yet caught up, but I would say that Powys has got a good uptake rate of breast cancer screening compared to Wales more broadly. But there are more women that we think are ready now to get back into screening. So if you know of women who will be eligible and have not yet taken up that invitation, please do encourage that to happen. And then I just want to raise cervical screening. We do in Powys have a higher uptake, and thank you to everyone who does pitch up to have their cervical screening. We know that it does save lives, and we actually know that there's been a bit of a downward trend of attending for this screening, which we hope that we can reverse. Couple of other areas, I just wanted to flag the specialist palliative care team were awarded special recognition by the Chief Nursing Officer for Wales in their work called Cariad, which is involving family members more in the care of their loved ones. And we've been implementing access to rapid diagnostic centres for people with vague symptoms that could be cancer as well. So a lot going on in this arena, much more than I could squeeze onto a slide. I'm going to move on now to an area called joined up care, and in particular to focus on urgent emergency care, because when you switch on your television, what you're most likely to see about the health service, particularly during winter, are the pressures that are in the urgent emergency care system. They are, however, no longer just winter pressures. We have been, as an NHS and a care system, under unprecedented pressures since the summer of last year. So you would expect in the NHS a bit of a lull in these emergency cases during the summer period, but that has not happened last year and is certainly not happening this year. We know there are patients who are delayed in hospitals because we don't have enough community care and social services in particular under pressure in relation to the availability of those sorts of services, and together with hospital delays as well, that means people are struggling to move through the system, and that does impact on the ambulance service because they then struggle to have their patients taken from the ambulance into the emergency departments in a timely way. Hospital flow is performing generally well within the health board, and we did some work which delivered on average 20 additional days for people at home as a result, and our minor injury units are performing well, but we are really keen to see if more can be done to enable that, more patients to be seen there. I'm going to briefly cover the last few slides, and the next one I want to touch on is workforce, because I have referenced workforce throughout this presentation. It is an enormous challenge for the health and care system, not just in Powys, Wales, but across the UK and in some other sort of international countries. I was reading something around Australia and New Zealand recently, and they have challenges too. So in terms of our workforce futures efforts, the slide which will appear shortly will give you a picture of the work that we're doing, particularly around a health and care academy. What the aim of that is to offer local access to education, training and development within the health and care system here and sector here in Powys. So it's a development that is with the local authority, with other partners as well, in particular the voluntary sector. We've developed an aspiring nurse programme, so 17 individuals working on a career pathway from healthcare support worker to registered nurse, and we are supporting people who need to step into employment through a Kickstart programme. Now, part of the key elements for us in terms of workforce futures is looking after the staff we have. I want to just recognise and echo the words of the chair at the beginning of this session by thanking everyone who has worked so tremendously hard over this such a prolonged period of a national global emergency. Staff wellbeing is a critical priority for us. We have strengthened areas such as occupational health, access to counselling, our emphasis on teams support, our emphasis on peer support is key. So I'm really keen to stress to everyone that we can look after patients and people in our community much better when we look after our staff. So that's really an important message from me, and lots for people to follow in this regard. We've got a big ambition around our workforce and our academy. Moving to the next slide then, I just want to touch on digital, because here we are holding, as the chair said, our third digital annual general meeting. We hope that hybrid might be back next year. I'm pretty sure that that it will be. But we've had to accelerate a lot of developments in terms of digital, and it has changed the way we work. And in many ways it's been fantastic. There are activities that we do much better when we're face to face, and of course it will be a mix, and we recognise digital is not for everyone. But I just want to give a flavour of some of the things that we've been doing. The self-management apps of My Diabetes, My Heart is helping people to look after their own health. But we've also made investments in ensuring that your information you share with us is secure. A lot of focus on cybersecurity to make sure that we have systems in place that people can be confident in, and we can be confident in as we develop more digital and electronic services. I'd like to move to the next slide, and that is about our innovative environment. And Steve mentioned earlier the 42,000 miles that will be saved through services, new ophthalmology services, for example. But as a board, back in September of last year, we made what we felt to be a very important public declaration around the impact of the climate change and the nature emergency. So the board commits to prioritise the delivery of actions in the National NHS Wales decarbonisation and biodiversity plans and go beyond them wherever possible. I'm really pleased that we now have a new Director of Environment, and that's a new role to cement our commitment to this agenda, and we're very excited about taking these actions forward. We have a great staff complement throughout the organisation who are highly committed to this, and so be working very closely with staff and other stakeholders. And last year was the year we had the largest ever capital funding. Now I'm always going to have sharp elbows if possible when it comes to capital funding for Powys, and that's because we do have the oldest built estate and the least new estate. But I'm delighted I was able to visit Machynlleth Hospital recently to see the development there. That is going to be a fantastic resource for people in the local area, as well as other capital. And just on this slide shows where we've been spending that money. And again, we've got a lot of ambition coming up for the future. Moving then to the transforming in partnership element, and just coming towards the tail end of some of my slides before we move to finance resources. We know that in Powys we work with a lot of different partners, both in Powys and connected to Powys. Our primary focus is ensuring and enabling the best possible services for the residents of Powys, even though some of those services are provided outside of the county. So we work very closely with Shropshire, Telford and Wrekin, Hereford and Worcestershire, Swansea Bay, Cwmtarf, Morgannwg, and less so now, but still in some key elements, Aneurin Bevan Health Board, and their changes are very, very important to the people of Powys, and we seek to represent the residents very strongly in that regard. We also, though, feel very strongly that we can increase our offer to people within the county. So we touched on this throughout the presentation of some of the services that we're bringing back in to Powys and developing anew as well. So there's just a couple of examples there. The diagnostic strategic intent, really, really important. We would like to do more diagnostics, so X-rays, CT scans, those sorts of things as close to home as possible, and we'll be doing some more work on that during this year. And the getting it right first time, they're reviews that help to shine a light on services and indicate where we can make services better than they are now. And then a final note on this, and it relates specifically to the North Powys Wellbeing Programme. We're absolutely delighted that the Welsh Government supported our programme business case for new development in the north of the county. And whilst the campus relates to Newtown, this is a network of service for the whole of the population of North Powys. Now we've pushed on, not letting the grass grow under our feet. So strategic outline case has been submitted, and Welsh Government are considering that at the moment, and we're moving on to the next stage. Many of these things can take a long time if there's a capital build, but to say that accelerated change projects are underway now. So the ophthalmology development we've referred to is one of those, for example. Let's not wait for a new building. Let's work on bringing that service in with some of the existing building. So just finally then, so how well are we governing our work here in the Health Board? And so I just wanted to share in terms of good governance, and it's been very disruptive, the pandemic, for sure. We've been having to work in very different ways, but the Health Board remains in routine monitoring arrangements. That means we're at the lowest level of concern and escalation for Welsh governments. So that is a really positive place to be, and many colleagues across the organisation have contributed to enabling us to be in that position. We've had a reasonable assurance opinion from the head of internal audit, which says our controls, how we manage the business, so to speak, is good. And we had a positive Audit Wales structured assessment, so they come in every year and have a look at how we're working. But I do need to be very clear that the organisation is working with lots of risks, and we've touched on some of these. So demand for services outstripping what we can meet at certainly a reasonable time frame, and we're worried about that, and we're going to be working tirelessly on that. The whole issue of inequity, so some people being able to access care and treatment quicker than others, that's a big issue for us. Our workforce challenges, and again in the national media, that was exposed over the last couple of days. These are quite long-standing challenges, and unless we can find a way forward, they will be challenges for us for the foreseeable future. And then money, and this is probably a good segue to move to Pete Hopgood, who is the Director of Finance and IT, to talk about the money and where we've been this year. But with a footnote from me is that the financial outlook does look rather challenging. So using every penny and pound carefully is going to be really important. So thank you very much, Chair. I'm going to hand straight over to Pete, if that's okay. Thanks very much, Pete.
Yeah, thanks very much, Carol. So I will focus on the 21-22 financial year firstly. For anyone interested, there's a full set of the annual accounts are included on the Health Board website. I'm going to take you through a few slides which hopefully are in a more easily understood and user-friendly format. So if we can move on, please. So against our two statutory duties, or three statutory duties, sorry, is one, to remain within our revenue allocation. That is to remain within our revenue resource limit for the financial year 21-22. The Health Board delivered that and delivered an £80,000 surplus. Against our duty to live within our capital resource limit, we delivered a £67,000 surplus and delivered against that target. We also have an administrative target, that is to pay a minimum of 95% of all non-NHS invoices within 30 days. Unfortunately, we came a little short against this target, and we hit a performance level of 87.5%. Next slide, please. We also have a duty to deliver within our revenue resource limit over a rolling 3-year period. And on this slide, this demonstrates our performance for the last 3 years in terms of revenue. So over the last 3 years, we've delivered a cumulative surplus of 278,000. I think what I just want to alert the audience to there is that, oh, the slides have just moved on. If we could just go back, please, thank you. Over that 3-year period, our total operating expenses was just over £1 billion. So against that £1 billion, it's actually £1,069,000 on the bottom right-hand corner of that slide. We delivered a surplus of 278,000. Now that's quite a remarkable achievement given the sums of money, given the services we're providing, the complexity of those services and the demands. And that's something you need to congratulate the whole Health Board, all budget holders, in their contribution to delivering that target and controlling our expenditure. Now we can have the next slide, please. So again, similarly, for our capital resource limit, there's a duty to deliver that on a 3-year rolling basis. Again, this performance is shown on the slide in front of you, and over the 3 years we've delivered a £97,000 surplus against a total capital spend of £25.5 million. Again, a significant achievement. Apologies, the slides are jumping back and forth. We can move on now, please. Thank you. So in relation to our administrative target, as I mentioned, to pay 95% of all non-NHS invoices within 30 days, we did meet that target in terms of the value of invoices paid, hitting 96.3%, the middle of those group of figures that you see in front of you. But as I said, we did fall short in relation to the number of bills paid. We're aware of the issue, the area that they relate to, and action's been put in place to correct that in this financial year. Next slide, please. So where have we spent our money? I guess there's 3 key areas where the health board spends its money. The first being primary healthcare services, the second being healthcare from other providers, our commission services, and then expenditure on hospital and community health services, our provider services. And as you can see, looking at the column there for 21-22, our total spend before reducing for miscellaneous income received was just under 400 million, around circa 398 million. And now we can move on, please. So the next few slides, we're using pie charts here to demonstrate how we've spent against those 3 key areas, and they're showing the spend for the year 21-22 and comparing it to 2021. And we've used the pie charts to hopefully demonstrate that the relative percentage spend has not changed dramatically year on year, even though the total numbers have increased. So for our primary care services, if I just highlight a couple of the key segments, the lighter blue segment is our general medical services. The green segment is our prescribed drugs and appliances. And then the grey segment there is our general dental services. And if you can, as you can see, looking at the years 21-22 to 2021, the segments in the pie chart remain broadly the same. The only key thing I wanted to highlight is that there was an increase in our GMS services, and in the main, that extra increase related to the COVID bonus payment that was made for primary care staff. Thank you. Next slide. So the next area of spend, our expenditure on healthcare with other providers, our commission services, and these are providers in both England and in Wales. And again, we've used the pie charts to make it easy to relate year on year. Just to highlight a couple of those segments, in the blue segment it is our NHS Wales services, so services provided by other health boards in Wales. For the orange segment, it's our non-Welsh NHS bodies, which in the main is our English providers, and then the grey area there is our committee services via WISC and ESC. Also in the other segments in there, you can see the green segment, which relates to our complex care, our continuing healthcare, and our funded nursing care spend, and also included there is the local authority and our voluntary sector. And again, broadly, you can see that the even though the total spend has increased, the areas of spend have remained broadly consistent year on year, as demonstrated by the pie charts. And just a couple of issues really to flag is that there was a significant increase in relation to our non-Welsh providers, in the main that being South and Wye Valley, and that related to the block contract arrangements that were put in place during the pandemic to protect both provider organisations and commissioning organisations. I do need to highlight the increased spend on complex care, continuing healthcare, which increased by 5.7 million year on year. And the other point just to highlight is that included in the local authority figures is 2.7 million that we spent as part of our test, trace and protect service. That was a joint service provided by ourselves and our local authority partners. Next slide, please. So this is now our provider arm, the services that we provide within the health board. And again, the pie chart is there, and you can see that the relevant segments have not changed dramatically. I think just to point out a couple of the key segments. So the blue segment is our spend on pay, our salaries, which takes up the largest proportion of the segment. It then includes sorry, the slides keep jumping back and forth. So, and then the other areas then include non-pay, our supplies and services, depreciation, which is a charge that we have to place against our assets, and some other sectors. But again, you can see that broadly the segments have remained consistent. Included in those pay costs, the staff cost, was a significant increase in relation to the annual pay award, the additional employer's pension charge, which is added, and then other increased costs in relation to the ongoing pandemic response, including our mass vaccination service. Thank you. So one important issue to highlight as part of our annual accounts process in relation to pensions tax annual allowance and the scheme pays arrangements for 1920. So in accordance with the ministerial direction issued on the 18th of December 2019, the Welsh Government took action to support the circumstances where pension tax rules were impacting upon clinical staff who may want to work additional hours but have determined that there would be a knock-on tax impact for them. So clinical staff who are members of the NHS pension scheme, who as a result of work undertaken in 1920 face a tax charge on the growth of their pension, and they may opt to have this charge paid by the NHS pension scheme. As part of the arrangement as per the ministerial direction and Welsh Government direction, the Health Board will then pay a corresponding amount to offset that scheme pays pension payment to make sure that there's so that the members are fully compensated for the effect of that deduction. This scheme is fully funded by Welsh Government and has no additional cost to the Health Board. Now, as part of the audit opinion provided by the Auditor General for Wales, they've deemed this expenditure to be irregular, and we therefore have a qualified regulatory opinion in respect of this expenditure. Now, this is not an issue which is just for us as a health board. It is something that is relevant to all health boards in Wales and be relevant to Welsh Government as part of their total annual accounts. Move on, please. So really, just to summarise what has been a good year in terms of financial performance. So we've met our statutory targets for 21-22 in terms of our revenue resource limit and the capital resource limit, both in year and over that 3-year period that I explained. And we worked against an improved IMTP. Also mentioned that our 2022-25 integrated medium-term plan has been approved, and the Auditor General issued an unqualified audit report on the financial statements for true and fair opinion. But please note the regulatory opinion, which I just mentioned in relation to the pension issue. So to sum up again, I just wanted to congratulate and thank the organisation and all members and all budget holders for their action in terms of deploying our resources in a way that we haven't exceeded our limits. That's been a fantastic achievement and well done to everyone. But I have to note, and as Carol alluded to, we do know that this financial year is extremely challenging, and we're going to need the support of everyone and the full board in terms of controlling our financial spend and limiting the impact of the pressures that we face. So thank you very much. I'll hand over now. I think I'm handing over back to Carol. Thank you.
Yeah, dear Pete, thank you very much indeed. And I'd like to reiterate my thanks to colleagues who collectively worked hard to make sure that we're able to manage effectively the financial resources that we are allocated by the government. So, Chair, that provides an overview, and it can only be an overview in the time available, of some of the key elements that we wanted to share more widely with people in this annual general meeting. And again, I would encourage people to have a look on our website. There's a whole host more information and detail, and I think I'm handing back to you, ready for questions.
Thank you, Carol. Diolch yn fawr. Very, very quick overview, very slick, and there's a lot of very useful information in those slides. So thank you very much indeed to everyone, the people who put them together, as well as those who presented. So I'm going to ask Adrian. I think he is going to support the question and answer session by picking up the questions and directing them to the right place. So I think we have a question and answer bar. I can't see any new questions in there, Adrian. I'm going to hand over to you right now.
Diolch yn fawr iawn, Professor Hartwood. Prynawn da pawb, Adrian Osborne ydw i. Nawr mae gennym ni gwestiynau gan y cyhoedd. So good afternoon everybody, my name is Adrian Osborne and now there's an opportunity for questions from members of the public. Thank you to people who've been submitting their questions during the meeting as well as in advance. And so just as a first question here, we've had some questions submitted by Derek Brown from the Royal College of Nursing and wonder whether this first one would be for Claire Roach, our Director of Nursing, as he's asking what is the Health Board doing to ensure safe staffing across all clinical teams, especially those without coverage within Section 25B of the Wales Staffing Act?
Thank you so much, Adrian. Good afternoon, everybody. Prynhawn da. So in answer to this question, the Health Board is, apologies, I cannot put my camera on. My camera is broken. I do apologise that you cannot see me. So in response to this question, there is a number of things that the Health Board is doing because none of our areas actually within the Health Board are covered under Section 25B of the Nurse Staffing Act. Nevertheless, all areas are expected to have staffing levels that enable us to be able to care sensitively and be able to provide safe, effective care to the people who we are caring for. So a forum has already been established within the Health Board, chaired by the Deputy Director of Nursing, looking at the Nurse Staffing Act. And since I've been in post, an additional forum has been established to actually establish a task and finish group reviewing the establishment on the wards, and ward managers are included within this forum. It's also really important that when reviewing our establishments and our staffing, that we consider that quality data needs to be triangulated. So we must be able to look at the quality metrics and outcomes for people on our wards and indeed the patient experience in terms of concerns and complaints, etc. And the other thing I would say is that operational arrangements are in place to be able to support escalation to senior managers where there is concern about staffing, including the silver on call. And of course, we would encourage all staff to use the DATEX system if they have any concerns at all about staffing. Thank you.
Thanks very much for that answer, Claire. I've got some other questions here from Derek Brown, but I'll come back to those in a second. And our next question came from a member of the public, perhaps Carol, if you'd be interested in taking this one, asking how in Powys do men who have sex with men access pre-exposure prophylaxis and monkeypox vaccination?
Oh, thanks very much, Adrian, and thank you very much to the questioner for that question. And it is something that I've had correspondence with people on, so I know it's an area of interest. And it is of particular interest to me as well, in that currently people are having to travel outside of the county to access PrEP, as it's shortened to, and that's because of the access to the more specialist sexual health services. Now, we are very, very keen to see what we can provide in Powys, and we are in dialogue with Welsh Government about that. In our integrated medium-term plan, which is the plan we commit to at the beginning of every sort of financial year, there is a priority in there in regard to delivering a sexual health plan, and that is going to be part of that, really trying to see about can we get this care closer to home, recognising some elements are specialist, and we work with people in multiple other organisations, but what is it that could be possible to have here in Powys, because I can understand the angst at having to travel for a service such as this. My understanding is there is good provision for the people of Powys, so people can access it, but it's the distance travel, and if we can bring that closer to home, we'll certainly do our very best to achieve that. Thanks, Adrian. I hope that that's helpful, but if the individual would like a bit more detail, I'm happy for them to get in touch with me.
Thank you very much, Carol. And I think I'll be linking with some colleagues as well, because perhaps some of the national websites could make clearer for our Powys residents how they access PrEP from neighbouring clinics as well. So we'll be taking that up outside the meeting as well. Now, my next question comes from a member of staff, and I hate to put Professor Hartwood on the spot, but it's a message for our chair, because a colleague just notes this is Professor Hartwood's last annual general meeting in your role as chair, so would like to ask her, what are you most proud of in your time in Powys Teaching Health Board?
Goodness, that's a really difficult one, because we've done so many things over the past 8 years now at the end of September. I think most recently I'm most proud of the Health and Care Academy that we've set up. I think it's innovative. It's the first in Wales. It's enabling Powys people to stay in Powys if they want to continue to learn in Powys, and with any luck to remain there as employees of Powys Health Board or of the local authority. So I think that is the sort of summit, if you like, and a very good place at which to be leaving the health board, although I'm very sad about going. I've had a marvellous time, wonderfully supportive colleagues, beautiful county, and even through the pandemic, so much support from the communities, helping one another, and staff helping one another, which is very important. So yeah, it's been a great time. Thank you, everybody.
And thank you very much to you, Professor Hartwood. And I've got a supplementary to that, which is that the staff member is also posing that question to other board members. So I might hold that one in reserve and come back to that at the end of the meeting, and ask a few board members for their thoughts on looking back at the last year. What are you most proud of, and what also has been your biggest challenge? So just wait to see if your name's called later in the meeting. In terms of other questions we've had submitted, now, Carol, I know we've covered quite a bit of this in your presentation, but in the knowledge that there's been a downturn in the recruitment and retention of nursing and wider workforces, what's the Health Board doing to mitigate that and plan for the workforce in future? So is there anything else you'd like to add to your presentation earlier?
Yeah, thanks very much. I just underline the comments of the chair in terms of the Health and Care Academy. That is really important for us to give opportunity and support people locally. So the big issue for workforce here, there are a couple of things. One is retention. It is not now sufficient to be just recruiting and replacing. We've really got to have an environment in which people do want to work and want to stay in work. And there's lots of things, particularly over the last couple of years, that have challenged people, which are getting highlighted, things like pensions and all of that sort of thing. But keeping people, because we've got some fantastic people in this organisation, and I'd like them to stay with us. So we'll be working on that. The second element is actually offering people some different opportunities, having career progression. So I know that the workforce team are looking at a retirement fellowship, for example. So for people who do retire, how do you keep in touch and offer perhaps some voluntary services? It just gives me an opportunity as well, Adrian, to flag how fantastic the voluntary sector is in Powys, and this is about a partnership in care, and they've been phenomenal. So I think there's opportunities for people to volunteer. That does not replace paid professional workforce, but it can supplement and add a really helpful dimension to it. And then finally, we know that word of mouth does help to attract people, and I sincerely want Powys Health Board to be the best place to work and to have a fulfilled career with all the right support. So there are our ambitions. There's a lot of work to do, but we're really committed to it. And Adrian, hopefully this time next year, we'll be able to update people even further on our progress.
Fantastic, thank you for that. And on the subject of volunteers, then I've got a personal interest in that, having been Programme Director for COVID vaccination and Test Trace Protect over the last year. So a special thanks from me to all of our volunteers who've supported those programmes, and hopefully will continue to support us into the autumn, which is a great segue into our next question here. And I wonder whether Ms Bowley, our Director of Public Health, might be happy to take this, with the question being, when will the autumn booster start, and also why is it not being offered to the under 50s?
Thank you, Diolch Adrian, Nada, Pawb. So in terms of the autumn booster programme, JCVI has made its announcements for the categories of groups that need to be offered the vaccination, and the teams and Adrian's leadership are planning currently to start at the beginning of September. JCVI review the data, and also they look at what's happening in terms of the virus and immunity levels. And the groups that are being targeted are sort of care homes for older adults and their carers, all adults aged 50 years and over, individuals who are in a clinical at-risk group who are aged 5 to 49, household contacts aged 5 and above, again, of immunosuppressed, and carers aged 16 to 49. The JCVI will continue to review the virus, immunity levels, and if they feel at that time that they need to add additional cohorts, then they'll advise accordingly, and we'll take Welsh Government's direction on those groups. I think, coming into Powys, there's been exceptionally high rates. Communities have responded really well to the vaccination programmes, and hope that continues into the autumn. Our best defence is vaccination, and would encourage people to attend when invited.
Fantastic, thank you. And there'll be invitations coming out for COVID vaccination and also for flu as well. Both of those vaccinations are going to be really important to protect us and protect our communities going into the autumn and winter. And linked to that, there was supplementary that was asked as well, which potentially I can answer, highlighting that one area where uptake in Powys has been slightly lower than in other parts of the country is amongst the 5 to 11-year-olds, and asking what we're doing about that. And so we have already in the county issued one invitation to all households, and didn't actually see the biggest uptake from that, particularly compared to other health board areas. So that's why we've taken the decision over this summer holiday period to reissue that invitation to every household, to every 5 to 11-year-old, to have their opportunity of vaccination if they wish to take it up. That's been starting just as this summer holiday period starts. And I'm glad to say that we've been seeing a great uptake from that. So if there's anybody who's still looking for their COVID vaccination from 5 upwards, we've got drop-in clinics available during the summer, and the opportunity is there for you to still come and have it, and we look forward to seeing you. And that includes in our new vaccination centre in Blynyddol, Wales, which has just opened this week as well, replacing the centre at the Bilth Wells Showground that Carol mentioned earlier about our celebration parade. And Carol, I think this next question is probably for you, which is, could you tell us a little more about the proposed new facility in Newtown, and specifically what sort of services might it include? Could it include minor injuries, for instance?
Yes, thanks very much, Adrian, and thanks to the individual who's asked that question. Absolutely. One of the key things for us is to try to provide more care in that part of the county more directly, without people having to travel very long distances out of county. Minor injuries, minor illness type services are really important, and the last thing people really want to do is end up in an emergency department with something that actually they perhaps could have had dealt with somewhere else. So that will be one of the principles really behind trying to develop a service. It may be called a minor injury service, but modelled on that, where we can support people with their urgent care needs. We won't be providing a full emergency department for a couple of reasons, really. One is we simply don't have the numbers for that, and we wouldn't be able to achieve the standards that are required for that. But minor injury unit, absolutely. We're very keen to provide services such as endoscopy and day surgery. And earlier, when I was presenting the slide on innovative environments about where money has been spent, we have invested in Llandrindod Wells Hospital over the last couple of years, and that has meant that we've got now fantastic theatre facilities there, and we think that we could develop the same sort of thing in Newtown. Again, more day surgery, not overnight and not highly complex, but it would prevent people from having to travel for some of the less complex procedures. We're very keen to have a children's centre, and of course the campus that's been identified at this stage has a school and a new school being developed, but also to use green outdoor space and to have community space. And then importantly, we've emphasised this a couple of times during the presentation today, space for learning and development, and another academy hub in that area. So I'm immensely pleased with the work that has been done with our partners in Powys County Council and wider stakeholders such as the Powys Association of Voluntary Organisations. It feels like a real partnership and a really great opportunity to deliver something really quite special and unique for the people of North Powys. So lots, and please do, I encourage people who are tuning in today to keep in touch, and we're planning to get out and about and speak with people a bit more about some of the detail over the coming months.
Fantastic, thank you for that helpful update, Carol. And as a resident of Newtown myself, it's very useful to hear about those developments underway, not just in Newtown, but right across the county as well, and the aspirations across Powys. So I just bring us to our final question now, conscious we're not able to answer every single one that was raised to us, but we'll use our channels to answer the questions we haven't been able to cover. Maybe I'll bring Claire Madsen in first, if that's okay, to ask that question. Looking back over the last year, what's been your biggest challenge, but also what are you most proud of during the last year?
Thank you, Adrian, for that. I think the challenge has been very much the transition from managing COVID and into recovery, whilst COVID hasn't really gone away. And the new challenges we've had with things like long COVID. So I think the thing I'm most proud of is, as the lead for allied health professionals and health scientists, how the issue of rehabilitation has really come into the fore, and rehabilitation is now something that everybody is aware of and sees the importance of. And the allied health professionals and the health scientists have really been able to showcase what they can do as a multidisciplinary team to support the people of Powys. So I think that's probably what I'm most proud of.
Thank you very much, Claire. And to put another director on the spot, could I actually bring Pete Hopgood in, our Director of Finance, to talk about what you're most proud of within the last year as well?
I think mine's quite general. I'm just proud of the whole health board, how they've continued to work hard and deliver in all the areas and all the services we provide, given the immense pressure, the challenge daily from responding to the pandemic, the challenge that we face in terms of workforce and other resource issues. So I think I'm just proud of that overall Team Powys effort.
Absolutely, and obviously you're here, Director of Finance, but also ICT and digital services as well. So I'm sure a lot of us across the organisation would pass on our thanks to those teams as well for everything that they've been doing to support us with all of the remote and agile working and the changes in processes, both clinical and management, that we've needed to take forward. So just as we bring this Q&A to a close, I think therefore I should give that final word in the Q&A to Carol to talk about, from your perspective, your challenges and your pride the year gone by.
Yeah, and they're connected, Adrian. So here are my thoughts. I did wonder if you would come back to me, so I was trying to get my thoughts clear. So what's the challenge? The challenge is my concern for people who have most definitely been negatively impacted by the pandemic, who are waiting too long for a service that they need, or that there's an indirect impact to people's health and well-being. And it's our job as a health board to do our very best to respond to that. And that's what's making me most proud, is the resilience and the innovation that is shown on a day-to-day basis by our colleagues right the way across the health board, but beyond that to the health and care system, whether that's primary care, the voluntary sector, or colleagues who work with us from local government, grabbing hold of those challenges and finding really good solutions to put in place. And I hope today we've provided a bit of a flavour of the work that our colleagues have done, and they make me feel immensely proud. So thank you very much to one and all, some of whom are part of setting up this AGM and have been leading some very major pieces of work, but actually to every single member of the health board. So thanks, Adrian, for asking me the question and giving me a chance to say them.
Fantastic, thank you. Now that brings our Q&A to a close, and I'm delighted now to hand back to our chair, Professor Vivian Harpwood, for some closing words. Thank you, everybody.
Yes, thank you very much, Adrian. Thank you, everyone who's been involved in this annual general meeting today, but also it's been a great pleasure to be here at this, my very last annual general meeting, but to have my special request acceded to, because we are now, as we close this meeting, going to see a film that I especially love, which was produced by Tim. So I think we can hand over to him right now. Diolch yn fawr.